Assalamu alaikum, namaskar, good evening, and welcome to the J&A Bharat HSC Foundation and J&A Global HSC Foundation's 48th OKT Outreach and Knowledge Transfer webinar on the very important topic, Stay Powered, Stay Safe, Electrical Safety in Hospitals 2026 and beyond. We request everybody to be on the uh, mute mode. Yes. Dinesh ji, I made you as a co-host. Yeah. Okay. Let me mute everybody. Okay, before we start, we would like to give a brief introduction about our program, the instructions. Mainly, people have to be on the mute. That's very important. So kindly mute your microphones and raise the hand whenever you want to speak. It's better we switch off the camera, the connectivity issues and other things. You can always post your queries, comments, suggestions in the chat box. And this meeting is being recorded for the future references. Kindly register your name, designation, email ID in the chat box for future communications. Of course, we have a ceremony group photo at the end of the vote of thanks. And you can copy the meeting link and share with your friends for joining. On the bottom right, you see the QR code there. That QR code belongs to the Foundation Knowledge Hub WhatsApp hub. And that belongs to the Knowledge Hub. Okay. And I just want to, I think it's better, Mr. We remove Mr.
Just a second, sir. Just a second. Sorry for interruption. Ashokji, sorry for interruption.
Yeah,
Mr. Sekhar, please. Mr. Sekhar, please mute your mic. I am muting you. Again, you unmuting your mic.
No, I removed him better. Okay. Okay, let's continue with our presentation today. Today, I think this week, I'm sure everybody is aware, 14th April 2026 to 20th April 26, the National Fire Service Week is observed across India. And every year, they come out with a different theme. And this year theme is Safe School, Safe Hospital, Fire Safety, Aware Safety, and Together for Fire Prevention. And again, our speaker of the day is going to briefly talk about this particular week, why we are observing this week, and what is the significance of this theme. In commemoration of this week, we are hosting today's webinar, especially on the fire prevention in the hospitals. Another important thing I just want to highlight today is also April 22nd, World Earth Day. And the theme for that is Our Power, Our Planet. And again, every world every world days are very significant for observing the theme as well as focusing on the theme, creating awareness. And this particular theme or this particular World Earth Day is emphasizing on the civic mobilization, demanding action on climate change, and promoting environmental education through marches, cleanups, and also and so on. So that's one of the important today. And today's program is going to be in two parts. Part one will be to 15 minutes or so, and we'll have a brief introductions. And we have a very important brief on the e-newsletter, Give Back e-newsletter. There are a lot of people are working very hard in releasing that newsletter. And we have Mr. Makbul Basha, is our social media and website chair. He has been instrumental in establishing a learning management system under our foundation's platform. We are launching that today. So a brief introduction will be given by Mr. Makbul. And the second part will be on the main subject, stay powered, stay safe, electrical safety in hospitals and 2026 and beyond. And we'll have a Q&A and networking as well. So with that, I would like to invite our fellow founding trustee, Mr. Jeetu Patel, for his quick welcome remarks. Mr. Jeetu.
और एक बार माइक जैसे देख
थैंक यू अशोक जी गुड डे
किधर
एंड
से जो
नमस्कार
अपना ईमेल से हैं ईमेल से जाओ
and good day to everybody. Honored guest, our today's respected guest speaker, Mr. L Jayanthi, who is the director of SJ Engineering and Consultants, Professor Ramana Guru, Mr. Narsim Rao Guru, corporate dignitaries, university faculty, and all my dear friends, professional leaders in health, safety, and environment. I, on behalf of all associated with JNA Bharat and JNA Global HSC Foundations, a very warm welcome to you all. Everyone knows who you just met, Ashok ji, Ashok Garlapati ji. He is my very dear friend and a co-founding trustee. Ashok ji is well known for his contributions, not just nationwide but internationally, for helping HSE profession and the professionals in their development. The important thing that I want to share about Ashok ji is that that I even say with great pride that he was recognized by the Board of Certified Safety Professionals at their meetings in Edinburgh in Scotland and also in Japan for his remarkable and significant contributions in advancement and development of the profession globally. He has served BCSP as a director for a number of years, as a president, and also as the past president, and he continues serving BCSP as the board of directors advisor. Ashok ji was also bestowed upon with the most prestigious, highest fellow honor awarded by the largest and the oldest health and safety professional organization, which everybody knows, American Society of Safety Professional. He's also a fellow of ours. I can go on and on and on, but that tells it all. Ashok ji, please do us the honor of conducting today's proceedings and help us all out. Thank you.
Thank you, Jit Sab, for that quick remarks and introduction. Of course, we would like to continue with our agenda items in a timely manner. So, yeah, that's a brief background about our founding trustees. But I would like to briefly talk about our foundations as well. And as you see on the blue flags there across the world map, these are the places where Mr. Jeetu and myself, along with the fellow professionals, we made some sort of a significant contributions in the field of health, safety, and environment. And we wanted to do something more for India. Of course, this is a repeat presentation for those people who are attending second time, but there are many people who are attending first time. We just want to honor their presence here today and just briefly talking about our foundation. So we wanted to give something back to India in terms of a health, safety, environment contributions. There are so many organizations already existing. The concept of foundation in the field of health, safety, environment is something new to India. So, there are so many deaths and industrial accidents are happening. That's a ILO, International Labour Organization statistics. Unfortunately, India is on the top for wrong reasons. So we just wanted to avoid those wrong, unsafe conditions and educate the people. We started this foundation on 25th March 2022 during the COVID time. Again, it was basically a virtual programs, everything was going on. So we started virtually on 25th March 2022 to serve India. As Mr. Jeetu already said, we have contributed in many parts of the world, and many of our fellow professionals approached us why you, limit to India. Let's focus on global. So with that initiation, with that encouragement, we established a global HSC foundation based in Arizona on 30th November 2022. So since then, our activities are going on. And again, we just want to highlight that it is not a membership organization. Nobody has to pay anything to get from our foundation. Only thing is you need to give it back. And there are so many volunteers, role players today. They are giving back to our profession. Mr. Adavi Bala Srikant, Mr. Ramana, Mr. Makbul, and Mr. Dinesh, Mr. Rangacharilu, and so many other people are in the pipeline. And because we just established a platform, there are so many people wants to give it back to the community through the professional organizations, through the corporate organizations, academic institutions, and so on. And our mission, vision, objectives are very, very simple: to support the HSC profession as well as the HSC professionals. So with that in mind, we have developed objectives basically to advance our profession, to support and promote occupational safety health as a career choice among the students, to inspire and develop the leaders in our profession, to provide educational developmental opportunities like we are providing today. This is 48th OKT. That means every month we have been doing these OKTs. And we also recognize individuals, organizations, as well as academic institutions who are really contributing in the health, safety, environment profession. We also do a lot of subsidized HSC training courses, auditing, as well as, we also align with the institutions or organizations who are having the similar objectives. So that's about our organization. As I was telling that we have launched almost a year back, we have launched the e-newsletter, electronic newsletter. On monthly basis, we are doing this. And recently, about 3-4 days back, we have released this one, which is April month newsletter we have released. Basically, I just want to introduce our editorial board, Mr. Madhu Nallan Chakravarti and Dr. Lakshmi Narayan, and the new member, Mr. Venkatramana Pondla. And you imagine there are a lot of work is going on this newsletter. And we focused on the recent incidents which occurred in India, the boiler explosion at Vedanta Power Facility. Basically, it's a compilation of all the information for the benefit of all our fraternity, what exactly went wrong, how can we prevent this, something like that. We compiled that, and there is a lot of information related to the stress management issues, and preventing the human errors is one of the important concept we need to focus. So human error by Mr. Jeetu Patel. He has done a lot of work in Saudi Arabia, in Saudi Aramco, with respect to this particular subject. So he has shared his article there, human error, and we also have another information related to the energy transition, the lithium batteries, what are the hazards related to the lithium batteries, how it can be disposed, and what are the different uses of the lithium batteries and safe usages. Those things were, authored by Mr. Ramana. And also we give the information related to that particular monthly webinar, which is happening today. And these are the different things which you are on the right side. You see there are several programs in our foundation, but believe me, these are all the voluntary efforts of the individual members, and nobody pays for anything. And we are continuing that effort. These are the different people. There are so many people are willing to help us. And today we are going to introduce the new volunteers as well. So this is about our foundation's newsletter. And another important thing happening today is very, very important thing happening today in our efforts, which is our launching of the J&A Bharat HSC Foundation Learning Management System. As I was telling that Mr. Sheikh Makbul is our God-gifted hand to support our foundation. He is our chair for the HSC social media engagement. He is also a HSC professional by profession. He is working in one of the global logistics company here. And He works around the clock for our foundation with respect to the website updates. And this is his brainchild, I can say. And today we are launching our please give a virtual claps, our friends. So he has done a lot of work on that. I'm going to hand over to Mr. Makbul. He will briefly explain about what is this learning management system, how our fraternity can get benefit out of this. Mr. Makbul.
Hi, good evening, sir.
Good evening. You can share your screen, Makbul. Yeah.
Yes, sir. Yes, sir. My screen is visible
Yes,
and my audio
very
is
much
clear,
visible.
right, sir?
Yes. Yeah. Go ahead.
Yes, sir. Thank you. Thank you very much. First of all, I would like to thank Jitu sir and Ashok sir giving me this opportunity where the word comes give back. Okay, but still in front of you legends, I am nothing because you gave me a chance to learn. I am learning every time something. So I am not a website developer or some IT background. No, it is just a passion where I learned by the help of Jitu Sab and Ashok sir. Whenever they give some task, I am going reading it thoroughly so I can memorize easily. So this is also one type of learning for me. So last year when we were searching in the website, I found LMS where we can do it. So this is our LMS website. Okay. So if you just type in the page lmsjabharathscfoundation.org. Okay. It will come your home page. Yeah, this is our home page. Okay, once you scroll down, here categories like quality, health, safety, fire. So once you click any of one particular thing, like example health, it will take to health related courses. Okay, like you can see confined space or handling, crane. Maybe you may get question. Crane, you are telling crane safety and why it is health. Yeah, if you see in crane safety, there is health related, environment related, okay, safety related. So these are the tags how we are using. And once again, if you go on click on the logo, JA Bharat, it will take back again to home page. Okay. This is our main page, landing page, what we call. Here you can see the courses and you can browse more courses. It will take to the main page of courses. Here, how can I contact directly? If you drill, you can find the phone numbers, email ID, address, everything. And again, how can I found course, where to study? The details, everything are there. J Bharat, email ID, phone numbers. Here our SMEs. Still the website is not complete, but here we have mentioned like our Jitu sir, Ashok sir, Ramna Garu, Lakshmi Narayan Garu, and yeah. So these are some basic things which is required for our home page. Now we will go direct to our courses page where we can get benefited. So in the heading, if you go in the courses, okay, so you will find here courses, chemical refinery, personal communication, confined space, contractor, contractor loss and prevention program, crane safety area classifications. So we have around 19 to 20, you can see in the bottom, one of two pages. So still second page is there. So in each page, 12 courses you can find, but still you get confused. If you are a beginner level or intermediate level, in the left side, you can select it. Okay. Example, now I am going to select a course, chemical refinery. Okay. You can see in the right side, this course is free. Okay. Duration, it may take 3 hours. There are 9 lessons. Okay. What you learn and material, requirement, type of audience required for this training. And here you can see it is a lock. Okay. You need to register to go through the course. See here, everything is locked. Okay. So I need to register. So the simple thing, just enroll and provide your details. So I have registered here. I'm using my username, password. Login. No, something enroll.
Yeah, that's a process we can say. Yeah.
Yeah, sir.
Mm-hmm.
I don't know why it happened.
That's okay. We can just fix that. So
Yes, sir. Because after login, they can see actually.
the lock, yeah, unlocked.
Yeah, and we can have. How do you rate this update review? We
Yeah,
can give the reviews here.
yeah.
You can select update review.
Mm-hmm.
Okay. Then just close it. Come down. Here it is telling retake the course. Okay. Now, once you come here in the course content, the chemical refinery, just click it. You can see now the course started. Introduction. Okay. Here there is a next button. And you can see the progress 9 out of 9 because recently I have completed it. So it is showing me 100%.
Okay.
9 out of 9. So left side again, if you see chemical hazards, here all are in green color tick mark. Okay. So this course is completed. Just go through the subject, press next, then again next start. Automatically next will come. If you have any comments, just enter the comments here. It will be reviewed later. Okay, next. So in this way, it is a very easy place where we can learn. Only the thing is we need to register there. And after all, in the last thank you, here there is a file, exercise file. Okay, you can download this PPT also. And we can have quiz also here, some knowledge questions, 1 to 5 questions we can include here. So in this way, we can complete it. If you need to see, you can go to your dashboard and you can see here, hello Makbul Basha, my name is displayed because I have login here. So enroll courses, I have enrolled 4 courses, active 2 courses, completed 2 courses, everything is available in the dashboard. So this will be your personal dashboard once you get login. Okay. Once you register, please go through profile and update the correct details. You want log out, you can log out from here. Left side, you have everything available. You have any questions, you can write down a question. If anybody want to become a instructor, if you see right side, become a instructor button is here. Okay, they can submit their application. Once it is approved, your training content will be added in the website. Okay, so your training material easily can be shared throughout the world. So these are the basic free learning courses which we are sharing with you. Okay, if you required any paid courses also, you can add it here. Okay, for example, I just want to share one paid course. If you see here, this is a paid course. Okay, it is cost of $125. Okay, so at now price is $100. Okay, if you become an instructor, so you can have your training content here. If like example, I am the trainer for defensive driving for in-house training. Okay, I have a certificate from National Safety Council. Okay, so I can issue a certificate. So my content I can upload here, and then I can fix a price after the approval. So this contribution also will help to our JNA Global and Bharat HSC Foundation. Okay, not only defensive driving, we can have fire extinguisher training and basic first aid training, where they can easily take not only day in the night also, they can have just 3 hour, 4 hours course, and some 10 quiz questions will be there. They can easily submit. If 80% marks reach, they are passed, certificate will be issued automatically. So this is a paid course. For paid course, I need to add to cart. So once it is in the cart, go to view cart. Then the payment option will be here. Proceed to check. This is what we call still under process, the payment. Okay,
Yeah,
once
we
it
are
is done.
launching first the free
Yeah.
complimentary courses. So that's
Yes.
what's happening. Yes.
Yeah. So that was for the paid courses, and the remaining all we have a free courses where you can utilize it. Yes, sir. Once I
Thank you.
selected free,
Yes,
you
yes.
can see all the free courses are displayed here.
Yeah.
Select it, do it. If you want to become an instructor, go to dashboard, and then you can select become an instructor.
Good, Makbulji. Everybody is asking,
Okay, sir.
we will have a separate webinar to explain more in detail.
Sure. Thank you, sir.
Thank you so much. It's a great hard work, and certainly once everything is done, we will have a exclusive session on this for all the interested people. Thank you,
Sure, sir.
Makbulji.
Thank
Thank
you.
you so much.
Thank you for giving the time, sir. Thank you very much, sir.
Sure. Appreciate. I just want to share my screen, Makbul.
Yes, sir.
Yeah. Thank you so much. And actually, we took little more time because such a wonderful learning management system which Makbul has developed. We wanted to just give a brief bird's eye view today, but as requested by many people, we will have a separate session on this. So with that, let's continue for on the today's topic of session on stay powered, stay safe, electrical safety in hospitals in 2026 and beyond. This session is being conducted in line with our National Fire Safety Week of India. And to introduce our today's speaker, we have our chair for awards and honors, Mr. Adavi Bala Shivasrikant. He's our volunteer as well as working as a TPL specialist in Kuwait Oil Company. Mr. Bala.
Thank you, sir. Thank you very much. Assalamu alaikum. Good evening. Namaste to good morning. Thank you very much, Ashok ji and Jitu Saab, for your leadership, and many congratulations to Maqbool for your wonderful efforts for inaugurating, for starting with this initiative, LMS system. So I always believe team together, everyone achieves more.
Yes.
So this is the beauty of this foundation. Everybody comes forward, contribute for the benefit of everybody. That's a fantastic, Maqbool, and let's keep doing that. We'll see how we can further contribute to this platform further on this. So the second part of the today's session is a great topic. And as Mr. Ashok said that we just concluded National Fire Safe Week in 2026 in India. The theme is aptly joins with the title of the presentation today. The theme of the Fire Service Week 2026 in India is Safe School, Safe Hospital, and Fire Safety Aware Society together for fire prevention. So as a co-group member in JND Bharat HSC Foundation, we professionally enjoy whatever the speaker of the day today he posts every day, without any tiresome. It is absolutely fantastic. So the topic which he's going to speak about highlights the critical importance of reliable and safe electrical systems. If you recall the number of hospital incidents which have been going in India since COVID 2020. So we had number of unfortunate fire incidents, especially in the hospital sector, in which we have seen a number of casualties of the patients as well as the hospital staff, which is highly unfortunate, which should have been not. So this session aptly joins with the theme of the Fire Service Week. The gentleman, the guest of the speaker, they're going to speak about various aspects of these incidents which have happened across India, resulting in deaths, at least various patients also. The incidents demonstrate how electric failures can quickly escalate into life-threatening emergencies in hospitals. As healthcare systems become increasingly dependent on advanced electrical and digital infrastructure, strengthening electrical safety through preventive maintenance, modern monitoring systems, and strict compliance with safety standards and robust emergency preparedness will be very much essential to ensure the hospitals remain both powered and safe in 2026 and beyond. So it's my honor to introduce Speaker of the Day, L Jayanthi ji. L Jayanthi Garu is a committed professional with experience in technical and safety-related fields, with particularly focusing on electrical safety and safety management in institutional environments. With a strong interest in improving workplace safety practices, Jayanthi ji contributes to awareness and knowledge sharing and electrical hazards, risk prevention, and safe operational procedures. Through professional involvement in safety initiatives and presentation, Jayanthi Garu supports the development of safer working environments and promotes the importance of effective safety management system in organizations. So, ladies and gentlemen, and my dear professionals, you all can understand how significant, how important today's topic for all of us. I'm sure that many budding professionals have joined today's webinar, and especially from my alma mater, Nagpur. And it's a great professional enrichment to listen to the finest and experienced speaker, especially in this field. So we all welcome on behalf of this foundation, Jayanthi Garu, to the virtual platform. Please.
Thank you, Bala. Over to our speaker of the day, Dr. Jayanthi, please. I will change slides whenever you say, sir. Yeah.
First of all, I thank JND Bharat for the excellent opportunity given to me. I know it's a great organization serving across various parts of the world. I'm fortunate enough to be as a member of this group. Though lately joined, I introduced some of the guys who are expertised in various fields. They must be in the forum also today. And I'll continue working with JNA Bharat as and when there is an assignment given to me, I'm ready to accept it. I want to tell this to everyone. in particular to Ashok ji and Jitu Patel sir and everyone. Thank you, everybody.
Thank you, sir. Thank you.
So, I'm not only a member of JNA Bharat, I'm life member of SCA also, Safety Engineers Association. They're also, we are doing excellent work. And next slide, please. I don't want to show all this, but I just want to tell you. Recently, I was honored with a doctorate, and which I'll be receiving on 27th of this month in Delhi. So this also I had after joining with JNDA Bharat only. I feel like that.
Congratulations. Thank you.
Thank you. Thank you.
Sure.
Next slide, please. So basically, as we talk about things, the electrical safety in hospital, the fire safety legislation for hospitals in India mandates strict compliance with the National Building Code, NBC of India. Prior to that, there is a tariff advisory committee that has been changed to NBC, and they embedded certain rules and regulations in that. And as per NBC Part 4, requiring valid fire clearance certificates for operation, key requirements include automatic sprinklers, smoke detectors, fire extinguishers, and regular audits. Hospitals must have 2.5-meter wide ramps, fire resistant structures, 2-hour rating for lifts, clear egress path, and staff trained in the fire drills, and so on. The key regulatory and safety guidelines are there available in a PDF form in the websites. Okay, NBC of India Part 4, Fire and Life Safety, the foundation code for fire safety requirement in hospitals is also exists. Ministry of Health and Family Welfare guidelines and fire and life safety guidelines also available. NABH Fire Safety Advisory, mandatory fire safety measures for healthcare organizations. Example, state-specific guidelines, Telangana State Fire Safety Guidelines for hospitals. Similarly, it is there for other part of states and central province in India. Next, please. Next, please. So, basically, the key safety components mandatory for hospital are fire detection and suppression system, automatic sprinklers, smoke detectors, fire alarms, and fire extinguishers as per BIS 2190, and structural safety, fire doors, smoke detectors, and fire rated structure for lifts and staircases, emergency egress minimum 2.4-meter wide ramps, and clearly marked unobstructed evacuation routes, operational mandates, regular mock drills, staff training, and appointment of fire safety officers, especially where there is more than 250 beds out there. Electrical safety, regular inspection of electrical roads and equipment to prevent short circuits. These are all there in the key safety components which are mandatory for hospitals. Next, please. So, hospital fire alerts a nationwide pattern in India. Apart from major disasters, 2025 saw several similar yet alarming hospital fire incidents. Facilities such as Sardar Vallabhbhai Patel Hospital and Vrindavan Children's Hospital suffered electrical fires linked to equipment malfunction and wiring issues. While no casualties were reported, the property damage and risk to patients and staff were significant. These recurring patterns indicate a systematic failure to adhere to electrical safety protocols and highlight why hospital safety audits are not optional but mandatory. So hospitals engaging the best electrical safety audit could secure their electrical system. This I just wanted to stress on this. Yes, sir. So in 2025, India saw continued significant electrical accident with short circuit being a primary cause of fires, leading to tragic incidents like the Jaipur ICU fire. Key trends and causes. Short circuit dominate electrical faults often from substandard fittings or poor maintenance, were behind most electrical fires, affecting homes, hospitals, and industrial sites. Distribution network risk. A significant majority of 61% of electrical accidents happened in distribution systems, with over 90% of victims being the general public, indicating severe safety gaps. The human factor, when we consider and we see negligence and lack of supervision, contributed to many incidents alongside accidental contact with live wires. So the key highlights, one is the electrical safety audits. 2025 year alarming incidents that emphasizing why every hospital, transport system, and public facility must prioritize electrical safety. The presentation today we are going to see covers the tragic fire incidents in hospitals like SMS Hospital Jaipur and others, multiple hospital electrical fires, SVP Hospital, Vrindavan Children's Hospital, and so on, and how electrical safety audits and electrical hijab helps in identifying and preventing life-threatening incidents due to electricity in hospitals. So is the thing. So basically, hospital fire alerts a nationwide pattern when I say, apart from the major disasters, electrical fires linked to equipment malfunction and wiring issues is one of prime concern. While no casualties were reported, the property damage and risk to patients and staff were significant. These recurring patterns indicate a systematic failure to adhere to electrical safety protocols. I said this second time because the importance to be understood by everyone and we have to propagate this message. So, hospitals engaging the best electrical safety audit can secure their electrical system too. So, electrical equipment and system inspection like e-hajab. How we do process safety hajab, electrical sorry, hazard operability study, there is a e-hazard study also, which having the three components, three elements. One is called SysUp, other one is called Upton, and other one called Safan. So the combination of the three systems when we examine through the e-hazard, we will identify the problems. And earthing and grounding checks, load balancing assessments. These are the things which need to be focused. Next, please. So, why regular electrical safety audits? The question comes. The electrical safety audits can detect risks early through advanced technique and energy efficiency evaluations. A comprehensive audit ensures that electrical installations comply with Indian standards IS and IEC, reducing the risk of fire, power failure, and equipment damage. So, energy audits complement safety audits by optimizing energy use and reducing operational costs, a dual benefit for industries and institutions alike. Sir, next, please.
Yeah.
The way forward, building a safety culture, a culture of safety, rather. So the incident in 2025 revealed a grim pattern: electrical negligence, outdated infrastructure, and insufficient preventive audits. However, they also point towards a clear solution: institutionalizing electrical safety audits as a standard practice in every facility. By collaborating with the electrical safety audit organizations, can ensure compliance, protect assets, and most importantly, saves lives. Every electrical fire safety audit not only prevents accident but also supports sustainable energy management, aligning with India's broader goals for safe and energy efficient growth. Next, sir. So, what happened as our Ashok Saab given me this assignment? This also came through the National Fire Service Week. So, During this, and our members also there, Mr. SPV Rangacharlu, Madhu sir and all, we all worked together on part of Fire and Security Association of India. We are in Visakhapatnam. I am also one of the member of that. So basically there we highlighted certain things on all the days throughout the week. This particular presentation I put on the day 7. First of all, highlighting what is the objective of National Safety Council of India, what the things they do, and the slide what is shown. I'll just show the clipping in order to educate the people why this National Fire Safety Week was started. So, please, sir.
मुंबई का वो दहकता समंदर, जांबाजी की एक अमर दास्तां। ये सिर्फ एक कहानी नहीं, ये उस दिन की गवाही है जब समंदर की आग में जल रहा था। तारीख थी 14 अप्रैल 1944, एक दिन जो इतिहास में बॉम्बे डॉक एक्सप्लोजन के नाम से दर्ज हो गया। वो मनहूस दोपहर, मौत का जहाज। दोपहर के करीब 2 बजे मुंबई के विक्टोरिया डॉक पर एक जहाज खड़ा था, SS फोर्ट स्टिकीन। बाहर से शांत, लेकिन अंदर मौत छिपी थी। उसके भीतर भरा था कपास, युद्ध सामग्री और करीब 1400 टन विस्फोटक। अचानक जहाज के निचले हिस्से से धुआं उठने लगा। कुछ ही मिनटों में धुआं आग में बदला और आग एक विनाशकारी तूफान में। वो धमाका जिसने शहर हिला दिया।
समय 4:06।
एक ऐसा विस्फोट हुआ जिसकी गूंज 80 मील दूर तक सुनाई दी। आसमान आग से भर गया, समंदर जल उठा और मुंबई कांप गई। सायरन बजा और बिना एक पल गवाए बॉम्बे फायर ब्रिगेड के जवान मौके पर पहुंच गए। उन्हें पता था खतरा कितना बड़ा है, फिर भी वे पीछे नहीं हटे। आखिरी सांस तक वे आग से लड़ते रहे। लेकिन उस दिन 66 बहादुर दमकल कर्मी हमेशा के लिए इतिहास बन गए। उनकी शहादत सिर्फ एक बलिदान नहीं थी, वो एक अमर मिसाल थी। उन वीरों की याद में भारत ने एक संकल्प किया। हर साल 14 अप्रैल को नेशनल फायर सर्विस डे मनाया जाने लगा। ये दिन हमें याद दिलाता है, कुछ लोग अपनी जान देकर दूसरों की जिंदगी बचाते हैं। समय के साथ समझ आया, सिर्फ श्रद्धांजलि काफी नहीं, जागरूकता भी जरूरी है। इसलिए 1995 से इसे बढ़ाकर 14 से 20 अप्रैल तक फायर सर्विस वीक इंडिया के रूप में मनाया जाने लगा। आज इस पूरे सप्ताह में स्कूलों में फायर ड्रिल होती है, ऑफिस और फैक्ट्रियों में ट्रेनिंग दी जाती है। लोगों को सिखाया जाता है, आग लगे तो घबराना नहीं, समझदारी से काम लेना है। जब भी आप सड़क पर लाल रंग की दमकल गाड़ी को सायरन बजाते देखें, तो याद रखिए, वो सिर्फ एक गाड़ी नहीं है, वो 66 शहीदों की विरासत है। अग्नि सुरक्षा सिर्फ दमकल विभाग की जिम्मेदारी नहीं, बल्कि हम सभी की है।
हम अग्नि के उपासक हैं, बलिदानों से कब घबराते हैं। जान छिड़क कर अपनी हर आंख दिखा दो, बुला दो हमें पर याद रखना। ज्वाला में जो जीते हैं वो अमर हो जाते हैं।
मुंबई का वो
Yes. Sir, this way, please, once again.
Yeah.
Okay. This way, what happened, fortunately, the government of India, through National Safety Council, they instituted this campaign with a theme, Safe School, Safe Hospital, Fire Safety Aware Society, together fire prevention. So on this, we done on behalf of L J Engineering Consultant, which is my company. So, and National Fire Safety Council and all the people, we did a program. Just I wanted to show that to the people here. Thank you. Next slide, please. So, when we come back to this electrical safety in hospitals, stay powered, stay safe. So, I put certain slides basically to inform. This also be conducted and educated people on the day 7, that is on 20th of April. Sir, next slide, please. So, basically, in hospitals, recognition of fire hazard and risk in a healthcare facility is important. Understand the fundamental aspect of fire safety, understanding of potential fire hazards and control measures, understand the overview of the fire protection system and be familiar with the overall administration of emergency management. This all we educated through the week on day 7. Of course, I just wanted to address here also. Next slide, please. Sir. So, the fire protection system and equipment, the basic fire fighting principles to be educated to all the hospital team members. Basically, telling them about what is the fire triangle, how about starvation, definition of smothering and cooling, and what is the importance of each and every system or equipment which is provided in the hospital. Okay, it's like a induction and training to the people. Every guy who joins hospital, at least first 1 2 days, they have to make them familiarize with the hospital fire safety equipment also. This is one part which will improve the system. Next slide, please. So, in general industries also, many guys they don't know about fire protection system, what is active fire protection and what is passive fire protection. So the teams whoever goes to hospitals to educate them, they have to tell them about active fire protection, like the devices which you have seen here, okay, and its importance, like a smoke detector, sprinkler, why this is provided, and what is the advantage of having this in the hospital. Similarly, manual and automatic firefighting system, fire hydrants, single hydrant, double hydrant, monitors, and the fire pump house, such things to be educated to hospital team members. Next slide, please. So another aspect is to be taught to the nurses are, because why nurses, one may ask, because 24 hours 7 some of the small hospitals, okay, there may not be a doctor, but nurse will be there to take care of the patients. So fire safety for nurses on essential guidelines to be taught, like know the fire response plan, like race, rescue, alarm, and contain, okay, and extinguish. This is the part how we are training to industrial people. This to be taught to the nurses also, and use fire extinguisher the pass method. Okay, pull the pin, aim at the base of the fire, squeeze the handle, and sweep side by side. How we tell this in the industry? Okay, this to be taught to the nurses also. Okay, and prevent fire hazards, they have to be taught about keeping hallways and all free and exits also clear. There is then do not overload electrical outlets or use damaged cords. Then know the evacuation plan. Every hospital also will have a evacuation plan, and they have to be familiarized with that. They have to practice that through the fire drills and all. Next, coming to electrical safety for nurses, a session to be organized on the best health care settings, like inspection of equipment at the beginning of the shift on daily basis, whether A shift or B shift or C shift, every nurse to check the equipment which have the electrical system use. That is a must. They have to do inspection. Then prevent overloading of outlets. So if they find any of the plug sockets and all, one to be there in one, say 15 amps or 5 amps like that. If there are two, she has to remove that and immediately report to the hospital authorities. Like keep electrical devices away from water. If to any region there is some water bottle in the form of for drinking and such things, okay, those should be kept away. Then know how to respond to electrical incidents. When there is an electrical incident, how to respond. This training also to be given to the nurses, and follow hospital safety protocol. Every hospital also will have its own protocol during emergency, what to be done, what not to be done. So this training aspects for nurses is a must. Okay, this I just wanted to tell to everyone to this gathering. Next, please. So now I just wanted to show the case studies. I don't read everything. I just wanted to read the headings only. When you see the year 2022, there are many incidents have happened in hospital. Okay, the first case in January, one only I have taken. There are more than one in January. So like that, every month I have taken certain case studies. So one is in January, fire breaks out at Ramanathapuram Medical College Hospital. This incident has happened in the medical college hospital. Okay, this is one case where fire broke out in a panel room on the second floor of a block of government Ramanathapuram Medical College Hospital on Wednesday night, prompting immediate shifting of patients to safer places. We know how much hardship they have to face in order to shift the patients and to save the patients. Until and unless we are well organized to avoid any short circuit and such things, we cannot help the people joining the hospital. This is one case in January. February, fire erupts in a gynecology ward of Una Hospital. The senior medical officer, as per him, because Chauhan, and other doctors also reached the spot for inspection. After this, the fire was controlled. Okay, this was happened in the hospital in the place called Ona. So this is the case in February. There is one more case in the month of March. Next slide, please. We'll go faster.
Yeah.
Okay, fire in Gwalior Hospital, over 190 patients rescued. So here, no casualty was reported, but due to one of the small fire, there are 190 patients, including 13 from the ICU, were rescued and shifted to another hospital. Okay, this is as per the official sources. And this is in April in Lucknow Hospital. Next, please. I'm not reading. I'm anyhow. This is going to be shared with everyone. Next is in the month of May in the Kozhikode of Kerala, Kozhikode Medical College Hospital, and it happened in the month of May. The incident occurred on the night of May 2nd, 2025. Casualties: 5 patients lost their lives. Here, lives also are lost. Earlier cases so far were not had. Here, 5 patients lost their life. The cause: a short circuit in the UPS room of the PMSSY, that means Pradhan Mantri Swastha Suraksha Yojana block, is the suspected cause. A blast reported occurred at the backup power unit attached to the hospital MRI section. The impact was approximately 200 patients and their attendees has to be evacuated as smoke engulfed fourth floor of the building. The investigation, the Kerala government ordered a high-level probe to determine if smoke inhalation directly caused the death and this is the due to safety lapses. This is the investigation finding. Next, please. Next, in June, ambulance catches fire in AAG hospital parking lot. This is in Hyderabad. So where the ambulance was parked, the ambulance is used, for the emergency care of the patients. That ambulance itself caught fire, so which gives a big shock. This happened in the Gachibowli, when one of the ambulance caught fire on a Saturday morning. That means the care by the individuals, like the hospital team members or the ambulance driver, is also an important part. So what to be done and all is the big question mark. Now the teams like us were educating, going to the hospitals going to the schools and awareness campaigns in the public societies. So next, please. In the month of July, 26 patients were evacuated after minor fire at Burns ward in state-run Victoria Hospital in Bengaluru. Okay, there's the same case is reported by two newspapers. One is the Hindu, the other one is Deccan Herald. Okay, so next slide, please. August, one dead, 10 injured as fire breaks out at Anand Vihar Hospital in Delhi. So this also I gathered from the two newspapers, the Hindu and the Times of India. So at least one person dead after massive fire broke out at Cosmos Specialist Hospital in Shadara Anand Vihar area on Saturday. This is the initial. So where eight patients were rescued and shifted by the fire department team. Next, sir. Next, please. This is also another case in August. I wanted to take one case. This is in September. Fire breaks out at MS Ramaya Hospital in Bengaluru. There is no major casualty. The fire started at the cardiac intensive care unit on the third floor of the hospital from suspect AC duct spark. So, like this, the scenarios related with the electrical systems. Okay, next, sir. So in October, the most heart-wrenching tragedy occurred on October 5, 6, okay, at the Sawal Mansingh Hospital in Jaipur, Rajasthan. So here a devastating fire broke out in the ICU of the trauma center due to an electrical short circuit. Okay, claiming the lives of at least 6 patients and critically injuring several others. The toxic fumes spread rapidly to the ICU unit, making evacuation extremely difficult. The incident destroyed essential medical equipment and raising grave question about the electrical maintenance and safety audit standards in hospital. Okay, the systemic failures like lack of alarms and sprinklers is the root cause found at this scenario. Next, please. November, there is a scenario in Madhya Pradesh, in Beetle District Hospital. Okay, the fire broke out at a storeroom, and the staff were alerted. And as per the official and the information, there is also a short circuit happened. Next, please. December. This is another case of the same thing. Next, please. Sir, next. So November, yeah, there are 4 instances in November. Please roll it, roll it. So finally, we see in the conclusion. So in December, fire erupts at a private hospital in Mumbai. All patients were safe. So the fire broke out in this private hospital in Mumbai due to temporary evacuation has been done, and the incident here also due to short circuit. Okay, wiring and installation in the MRI CT scan room is the root cause. Okay, next, please. So December, that happened on 30th and it happened in 31st also. One in New Delhi, and another slide is there. Another slide, please. Okay, another slide also. So this is also another scenario happened on December 30, Sanjay Gandhi Hospital, Rewa, in Delhi. Okay, here everywhere. Next, sir. Next, please. December. Skip it. So, when we talk about these things coming to January 2026, in Ullakhara, Bhubaneswar, there is one SCM hospital is there with a medical institute. So here also an incident happened due to installation failure. Okay, the fire services person used a hydraulic lift to evacuate the people. This is the deemed university of Odisha. Next, sir. Fortunately, in the month of February, there no incident has happened in India, or it was not reported also, we don't know exactly. But in the month of March, fire at hospital intensive care unit, which killed 10 people. Okay, this happened in Odisha. Okay, so the fire which started early morning on the first floor of the SCB Medical College and the hospital in the city of Cuttack, and was likely caused by a short circuit. Why I'm taking this and reading the lines are everywhere when you see it is due to electrical short circuit or an incident with the failure of systems, means electrical installation, electrical wiring, and such things. So what says to us, what gives us a point of electrical thing? This is in Bengal. One minute, one minute. This has happened just on April 21st. That's yesterday only. At the Salt Lake area, there is a hospital, okay, private hospital. Fire broke out. So these are the things. Luckily, there is no casualties occurred. So like that, when you see the number of incidents are happening in hospitals, basically because of various things, the we'll see in the next slide, sir. So it is the slide which I have compiled from the help of JNDA Bharat itself. Ashok sir has transmitted to me, and he has shared in some of the areas. So basically, I compiled all of them as one slide only, but this is not one slide, these are 9 slides. So 2026 regulatory shift in India, which mandates fire safety audits and electrical lead audits, regular fire anniversary renewals, focus on ICU and critical care zones. The electrical safety is the key risk area due to overloaded circuits, improper earthing, aging wiring system, generator and UPS integration risks, and ICU fire safety requirements are smoke and heat detector, fire extinguisher per bed area. These are the requirements. Emergency lighting system, fire alarm panels. So the governance and accountability, fire safety officer is mandatory in every hospital, and monthly inspections also to be made compulsory and mandatory. Documentation, compliance tracking is also important, and legal accountability has to be taken care. And training and emergency preparedness, quarterly fire drills, staff training twice a year, evacuation protocols, race and pass systems, as we spoken there about the nurses training. Okay, these are to be taken up. And continuous compliance model, like shift from one time NOC and periodic audits, real time monitoring, integration with the NABH standards is to be made as the compliance model. The future trends from 2026 to 2030, AI based monitoring and IoT for detection and smart electrical system, global standards adoption comes. An action plan for hospitals, conduct electrical audit, upgrade fire system, train staff, implement monitoring system. The key message is hospital fire safety is electrical safety plus engineering plus governance. The three together give the hospital fire safety formula. Okay, this is what we wanted to tell up to here. Next slide, please. So, the electrical safety in hospitals basically care to be taken, particularly the people who are not in a position to walk and all. Okay, this is one. The classroom training is must for everyone. Okay, like the theme given this year, hospitals, schools, and societies. Okay, everywhere. Similarly, practical training, okay, inspection and audits from the respective agencies and government sector, an evacuation plan of emergency, an emergency rescue process to be taught to everyone and practiced. Okay, next slide, please. Conclusion is in India, DG Fastly Mumbai trained and certified various organizations on hijab and electrical hijab techniques, striving hard in improving fire safety practice such as trainings, inspections, and audits. The lessons learned from the scenarios, as discussed in the previous slides, reminds every organization to retrospect on the present situation and the best practices to be adopted in line with statutes and worldwide best fire safety practices. As a member of FASI India Vizag chapter, request all participants to try your best in propagating the message as many to as many as possible. The key message, as our Ashok sir has said and given this to us, hospital fire safety is nothing but electrical safety plus engineering plus governance. So this I just wanted to share with all the land team of J India Bharat. Next, please. One more slide is there, sir.
Oh, one more is there. Okay.
That is nothing but thanks only.
Okay, no problem.
Thanks, gracias, ధన్యవాదాలు, like that.
Yeah.
Thank you, everyone. Thank you.
Yes. Now we have to put that slide, sir. No doubt in that.
This one.
Yes.
Sir, if you allow me, next time onwards, when I have the opportunity, can I use this JNDA Bharat logo on this side? I'm not sure. That's why I've not used.
Yes. Whenever you are using it, no problem. Let us know for which event, so we can also propagate that here.
Okay, sir. Thank you, sir. Thank you, everybody.
Thank you very much. Thank you, Dr. L Jayanthi, and it's our pleasure to host you today. I'm sure everybody would have got a lot of benefits from this presentation. So let's go back to our today's agenda, continuing with the program. So our Q&A session is following now by Mr. Dinesh Kumar Paul. He is our chair for HSC Communication and Leadership Skills. Mr. Dinesh has got another appointment in 15 minutes, but he is honored to be here today with us. Mr. Dinesh.
Thank you very much, Ashok sir. And I request to give all the virtual or physical clap for our presenters. How wonderful, informative session he presented. I hope everyone got the benefited. And as I posted in the chat, if anyone have any queries or questions from the presentation, or you want to ask anything to our presenter, just raise your hand, or you can send the chat. Still, don't waste the time now to sending the chat. Just you raise your hand, and we will allow to talk to you directly to our presenters. And for better visuality, I request to Ashok sir, please stop the sharing. So we can see the audience in full screen. Yeah. So audience, it is your turn. Please raise your hand if you have any questions, queries. I think no one have the questions. I will give you 10 more seconds to raise your hand.
I think I posted a question about the e-Hazap.
Sorry, I could not mention.
He has shared.
You can carry on.
Yeah, e-Hazap, Dr. Jayanthi shared 3 components. Can you please explain that, sir? SASAP, AWAP, something like that you mentioned.
Yeah, actually, how we go for process safety hijab with the guide words and all. Here there are three elements. Okay, these three elements with the combination of certain parameters will go side by side for verification in the field, including the equipment and all. So that is a aspect to be taught if you give an opportunity on one particular short-term visual thing also we can do. Zoom
Very good.
meeting like.
Sure,
Okay.
sure. You can do that. Yeah. Thank you. Back to you,
Thank you.
Dinesh. Yeah.
Thank you very much, sir. Thank you. Is any other gentleman who have any question, queries?
So let's continue, Dinesh ji, and with that, we will honor our today's speaker, Mr. Jayanthi ji. Thank you, Dinesh ji. Jitu
Well,
Saab.
And I will take permission from you because I
Yes.
have another meeting.
Yeah, thank you.
I will
Thank
take
you,
leave.
Dinesh.
Thank you,
Yes,
sir.
yes,
Thank
yes.
you.
Jitu Saab,
Thank you.
please. Yes.
All I wanted to say that when there are no questions, the speaker did an outstanding job covering the major aspects, and he highlighted to us the importance of focusing on hospital fire safety, which he demonstrated giving many examples showing how many incidents, accidents, and fires resulted from electrical systems causing devastation and totally, in some cases, fatality and inconvenience to the patients. Now, this was not an isolated case in one place or two, but throughout the nation in India. And he highlighted some of those examples that included Kolkata, Mumbai, Delhi, Bangalore, Hyderabad, and so on. So we want to thank Mr. Jayanthi Lachahia that what a wonderful job he's done educating and highlighting this concern, major concerns to the hospitals. And if I remember correctly, during the pandemic, in about 2.5 months' time, we counted 29 hospital fires, including lots of fatalities. That really needs to be addressed. And he gave us, we thank him for giving us the guidance in how to mitigate those hazards, especially last but not least statement he made, hospital fire safety is equal to electrical safety plus engineering aspects plus good governance, and that is the key. And I think management as well as all the health and safety expertise should focus on his advice and do our best to mitigate, in fact, preferably remove any incident occurring in future. He deserves this virtual recognition, which we from the foundation say thank you, Mr.
thank you, sir.
Jayanthi ji, for doing an excellent job, sharing his knowledge and experience, and keep up the good work. Thank you, and accept this recognition from the foundation. Thank you.
Thank you, sir. Thank you.
Thank you, Jayanthi ji. Thank you, Jitu Saab. And let's continue. Of course, we would like to thank our financial donors for our foundation who have been supporting on various aspects. And we also have a knowledge donors like Jayanthi ji has done today, the 48th OKT. These are the different subject matter experts who delivered their sessions through the OKT sessions. And these are our knowledge ambassadors through J&A WhatsApp group. If you are not a part of the WhatsApp group, there is a link in the chat box which I'll be posting. It's also there in our flyer also is in our website as well. So please do join in our WhatsApp group. You get the round-the-clock updates on the different aspects. And yes, of course, these are our governance body and functional committee members. And today we are introducing our new volunteer. We have been knowing from many years, but now he was in different aspects. But we invited him, and we had a conference call also with him. Dr. Karupaswamy Ramanathan is our associate dean and coordinator at Lovely Professional University in Jalandhar, Punjab, and has got a 25 plus years of experience. He's a gold medalist and done a lot of leadership roles as a principal, and he was involved in the institution building with the strong professional collaborations, and he's also professional association of a former general secretary of ASSC USA and India chapter. We started India chapter with his support back in 2012, governing council member of Coimbatore Management Association, and he has written a lot of books and contributions, training and accreditation. And he's also Rotary Club involvement is there. 47 initiatives he has done, and he has been awarded as a man of charity by UN Global Peace Academy, man of social work IDA Asia, and beyond academia, poet, novelist, and artist, and cricketer and cricket academy owner. In fact, I was telling you about our Give Back e-newsletter, and Mr. Dr. Karupaswamy Ramanathan will be closely working with our editorial board, and Mr. NCZ. Mr. NCZ is also on the call now. He was sharing me that next in the Give Back newsletter, he is going to have an article on the presentation skills for HSC professionals and etiquette during the training program. So Mr. NCG will be sharing that. Dr. Karupaswamy Ramanathan, we welcome you wholeheartedly to support our foundation. Mr. Jeetu, would you like to say a few words about Dr. Ramaswamy Ramanathan? Krishnaswamy Ramanathan?
All I can say is it's an honor to be rubbing shoulder with Dr. R.K. Rangoli ji. I feel so elated. Whenever I see him, whenever I am with him, I always say, I want a picture with you. A handsome young man, and he's powerful in his knowledge and experience. And I feel so honored. And really, we have been working together with him since 2012, as you said, Ashokji. And he's a powerful contributor. He has produced so many PhDs under him, under his leadership. And I feel that we will be making a big difference with him, with us in our foundation's operation. And we warmly welcome you, Dr. RKG, and we will be continuing working as always we did in the past. God bless you for your voluntary time.
Thank you, Jit Saab. Dr. RK is on the line. He was there, but now I'm just checking. RKG, are you there? Would you like to say a few words?
Thank you so much, Jitu sir, and again reconnecting with all experts. I think Makful also mentioned about it. When you are with the allied people, automatically you start working, and we are able to see the outcome also with Makful. Is a great inspiration for me. And apart from that, I think today's speaker, I think he made a 360-degree focus on all the elements. That's why, the session also went on well and ended without questions. So these are all the learning experiences. I think happy to associate and ready to join hands with the other team members also to contribute the best. Thank you, sir. Thank you for the opportunity.
Thank you so much. And we have 4 minutes left for it's already, end of the day in India, and upcoming programs. We have a 49th OKT on 27th May by Mr. Grant Thompson. He's our good friend, and he's working as a director in HSC and well-being. Imagine you see the title, HSC and well-being in HUP UK. It's a supply, I think it's a supply chain company across Europe. And he'll be talking about the topic on connecting people with purpose, an ideal strategy. It's ideal strategy for HSC engagements on 27th May 2026. And let's give back to create a safer tomorrow, as Mr. Makbul said, endorsed by our Dr. RK. Let's give back, and these are our foundation's account numbers, and it's legally registered in India. And this is our global account numbers in India. You're welcome to contribute financially and knowledge-wise, as well as a knowledge hub we have it in. This is our QR code where you get a lot of information about our activities. And with that, we would like to invite Mr. S.P. Rangacharilu for giving vote of thanks. Mr. Rangacharilu. Rangacharilu, are you on mute, sir?
Yeah, I'm muted.
Yes, go ahead. Yeah.
Thank you, Ashok ji, for giving me this opportunity. On behalf of JNDA Bharat HSC Foundation, I, SPB Rangacharilu, share my chair for fire and safety awareness, presenting vote of thanks. We thank Ashok ji for his opening remarks and giving us an overview on JNDA Bharat HSC Foundation. And he also thanks for sharing the editorial and their team contribution like Madhuji and Lakshmi Narayan ji. And he told us about the World Earth Day. And we thank Jitu ji for his welcoming address. And he also congratulated Ashok ji for recognition by a board of certified safety professionals. And we thank Sheikh Makbul ji about JNDA Bharat HSC Foundation, that LMS, Learning Management System. In the learning management system, Makbul ji, he explained us various courses, paid and free courses, and some exclusive. And actually, Makbul ji should take a separate exclusive session for explaining us on LMS. And now I would like to thank Balagaru for introducing Jayanti ji. So Jayanti ji gave us an excellent session on technical session on stay powered, stay safe, electrical safe in hospitals 2026 and beyond. And he also explained about e-hezab. For e-hezab, he in fact he wanted a separate session. I think which he will get it during maybe next opportunity. Thanks Dinesh ji for his moderation. I thank all the members and participants for taking out time and coming over here. We thank all the knowledge and financial donors, and we thank Dr. Kurupa Swami ji joining us and giving his valuable inputs. And last but not the least, we thank Ashok Garlapati ji, Jitu ji, Ram and Lakshman, for bringing us together and giving us an opportunity to join on J&A Bharat. Thank you.
Thank you so much, sir. It's running out of the time, but Mr. Jitu wanted to say a few words about our Mr. Makbul, LMS creator. Mr. Jitu, go ahead.
Thank you, Ashok ji. Before I talk about Mr. Makbul, I want to share with everybody on this call, and also it's being recorded, that the e-newsletter you highlighted earlier, Ashok ji, it goes a long way. 2 days ago, I received a feedback on the recent April edition of e-newsletter from a company called Jacobs, which is the software engineering company employing 41,000 plus employees in the United States. They have around the world offices, and in London office next to London Bridge, they had a big fire and they had a humongous evacuation due to that fire, which resulted from lithium ion battery. So they were very complimenting to the foundation for a timely information for their company to think about and then do something to the storage of laptops. So I'm just encouraging everybody on this call that if you have any information, any articles, please share with our editorial board so that you will be making a difference in the world, not only in just in your own company or nation, but worldwide. Number two, I want to say thank you to Makbulji because my vision was along with Ashokji, and we both started this almost like so many years ago. And the vision was that my 55 plus years experience, I have so much information and I did not know how to I can share with everybody. And that's where Makbul Saab, he is the one who you just saw just a brief about it, and I agree with you all that that demands a special session on this so that everybody can seize how much valuable information is put in that website. And I also encourage others, if you have something that you can add on to this, and we can make it a Nalanda and Takshashila library on health and safety. So I applaud to Makbul Saab for what he's done. It was educational. The information we provided to him, he put it in a beautiful IT, utilizing his experience and knowledge. And you can imagine how much time he must be spending to do that, what he has done. So thank you, Ashokji, for letting me talk, compliment Makbulji. Last word is for our speaker. And our speaker, it's a request only if it is permissible and also IT-wise possible. I enjoyed watching that little video you showed on that boat fire, which really made Mumbai really rock. And I think it would be good if you could share it with me so that I can also help many more while before I actually stop breathing. So I really, if it is possible, share it with us. Thank you, Ashokji.
Sure, sir. I'll share it.
Thank you so much, Jitu Saab, and it's already running time. As Mr. Bala said, as a team, everyone together achieves everyone more. Together, everyone achieves more.
Correct.
We would like to thank everybody and join hands with us in giving back to our profession. Let's make a positive difference as a HSC professional. Thank you so much. Let's continue our efforts. And Mr. Jitu always says, let's take a picture. So let's see how many are.
Absolutely right.
Kindly open your this thing so that cameras, you can open it.
It's a delighted to see our Professor Ramana Guru.
Yes, I know, yes. Okay, Kayur, Pandya, looks like.
Dr. Rangoli, come out.
Everybody adjusting their hair. I don't have the hair. Okay. Nice. Mr. Maleshwara Srinivas, go down. We are missing your face. Yeah. Okay. Nice. Thank you.
Thank you very much, Jayanti ji.
Thank you. Let me stop recording. Okay.
Thank